machine. I suppose we're all familiar at this stage with acupuncture and Chinese traditional medicine, sticking in of needles at particular points in the body and so on. Well, now a new handheld machine drawing on the principles of acupuncture has been introduced into this country. It's called an Aculife. It looks for all the world like a mobile phone with an aerial or a wand sticking out of it. And it's said that when this is passed over your left hand, well, magnetic fields pick up and identify imbalances in your body. It's used as a diagnostic tool and also for pain relief. Our Helen McInerney nipped down to Kilkenny to see it in use.
There.
Okay, that's the spot?
Yeah.
Okay, now I'm just going to flick that over to the relieve mode then. Stimulus may drop off a little bit and then we'll pop it up one just so it's comfortable. Okay? Now get used to that.
Bernadette Mullally is attending physiotherapist Neville Cohen because of a severe shoulder pain. Bernadette works in the catering industry and did the damage while at work. As well as conventional physiotherapy, Neville has also used the Aculife magnetic wave device to treat her pain.
I was cooking and shook and turned around to the right hand side and I just heard something click and thought no more about it, continued. And the mistake I made, I stayed working for 2 days until I couldn't work.
Bernadette went for an X-ray and was then referred to the physiotherapist.
The pain was going from here the whole way right down into my arm and into my fingers. And it was like I was on all fours. It was just really, really horrendous, yeah. And as I said, the X-ray showed up nothing. But Neville introduced this little machine here and it picked up that there was something in the neck region. So at that point then he discussed it with Mrs. Lanigan that he needed to send me for an MRI scan, which that confirmed that there was a bulge in the disc, C7 disc. And he's been treating me since with physio and the machine. And each time I'm on this little machine, I get at least 24, 48 hours most of the time pain-free. Now in the beginning I was on 13 different painkillers a day. Now in 4 weeks I'm down to 6 as today. And I'm improving the whole time. And it's just amazing to think, you know, it's this little machine and the physio, the whole works. It's working well, yeah.
You don't think it may be your imagination that it's the machine that's doing the work?
Absolutely not, no. Absolutely not, no.
Well, maybe you'd be getting relief anyway from the exercises.
Well, I'd imagine would be combined both, you know.
And
when the machine goes on, the pain is just like a needle going down through you. And you don't feel it here, you feel it here. But you actually get the relief here over the next couple of hours then. You know, because this one is for the neck and this one is for your arm. And you get pain relief then for a couple of days afterwards then.
The Aculife machine is described as a diagnostic and pain-relieving machine. The small portable device was developed over 16 years by Taiwanese, Chinese and Japanese scientists. It's based on the traditional Chinese and Eastern medicine belief that if a disease or imbalance develops inside the body, the signs of that will manifest themselves on the outside. The makers say the Aculife works by sending a magnetic pulse from the control areas on the palm of the hand or ear to the corresponding area in the body. They say it improves blood circulation and strengthens the immune system. Neil Strickland, a management consultant who is importing the machine, says a lot of people are getting relief from it.
It is very, very useful at picking up problems in your body. Anywhere where you have a problem in your body, it will give you a prickling sensation on your hand. Basically, it shows up energy blockages within the meridians, just like traditional Chinese acupuncture. Not only will it pick up the points in your body where you have a problem, but by turning the machine into relief mode, it sends a magnetic wave down through the body to clear those energy blockages in much the same way as a traditional acupuncturist would do. Using the machine for an average person, maybe half an hour, 40 minutes a day, it's very useful for managing pain for most conditions. It's not a cure-all, it doesn't solve all the problems, but a lot of people claim to get a lot of relief from it.
Neil says the machine works on the same principles as reflexology.
It's extremely similar to reflexology in that all the acupoints that are in your hands indeed are replicated in your feet and in your ear. So anywhere there's an energy blockage will show up for a reflexologist doing their traditional treatment. What I have found in the last year using the machine is that reflexologists have bought them to aid them in their diagnosis, which cuts down on the amount of time that they spend with a patient from a diagnostic point of view, and they can get straight into doing the treatment.
Neville Cohen, a chartered physiotherapist, has been using the machine for over a year with very good results.
Very good results, yeah. We've been documenting them recently enough in the Aculife hospital here. Not enough, obviously, to go through a full clinical trial yet, but hopefully that will be the plan. And so far, so good. Patients have had good results, mixed with normal manual physiotherapy techniques, and the pain relief and the benefits seems to have been very good.
Neville says that when he first heard about the machine, he was open-minded, but wary, because there are a lot of gadgets on the market.
I think you always have to be a little bit sceptical. Open-minded, but sceptical all the same. And certainly until you've used it, until you've used it on enough patients that you can make some sort of, clinical judgment on the machine.
Well, my curiosity got the better of me, so I decided to ask Neville to try out the machine on my hand.
Okay, I'm just going to run the wand up along the bottom of the thumb here, and I just want you to tell me when you feel a strong stimulus.
Oh, there.
Okay. Now what I would do then is I would just mark that off with a pen, and then we'll come back to it later on. That point there would represent somewhere in the region of the lumbar spine, one of the 5 vertebrae there.
That is actually like getting an electric shock, yeah. I would imagine. When you hit an electric fence, that's the kind of
stimulus
it is. A sensation.
And again, at the very start you can be quite sensitive to it, but once you get used to the stimulus, it should reduce all the way down. It's the initial reaction to that feeling that kind of makes people a little bit jumpy.
The machine did appear to pick up an old back injury of mine. It's described as a complementary device, and, says Neil, there's been a mixed reaction from the medical profession.
Some are very positive, others look on it as a gadget. But it is approved as a medical device in the EU, Class 2A medical device. It's approved by the Food and Drug Administration in the United States. So the product has efficacy, so I don't worry about it from that point of view. It's just a tool that people can use to help manage their health.
With a price tag of approximately €300, the machine doesn't come cheap. But, says Neil, it's worked for him and he wants others to enjoy its benefits.
Just going to start at this point here, Helen. This would represent the sacroiliac joint, and then coming up from the bottom of your back.
And you